think is important.
All right, so good morning. This is Robo, and I'm here today with my friend and colleague, Dr. Rob Franklin. Dr. Rob is a veterinarian and a board-certified internal medicine specialist. That's those big, long string of letters that you'll see behind a person's name. That gives them credentials because of all the long hours they spent through school. In fact, I think it's just thousands of hours of additional school after you get your veterinary degree to become board certified. Rob is on the board of the American Association of Equine Practitioners, but he also has a lot of experience and understanding of the pet physiology as well, and these are things that are taught in veterinary school. I just want to kind of give you some backstory on Rob, and good morning, Rob.
Hey, Robo. Good to talk to you.
Yeah, you bet. And so you're there in Fredericksburg, Texas today.
We are. It's a beautiful day down in the Texas Hill Country.
Awesome. So, I just wanted to visit with you today and ask you some questions. Some of these are questions that we get from time to time that I thought would be interesting to cover. Rob is also the co-founder of FullBucket Animal Health. Rob and Dr. Keith Latson founded FullBucket, and I'm sure Rob will go into some detail on how that all got started. But I thought we'd kick off today by just getting into some of the problems and things that people are going to find in their horses, and some of the solutions you've come up with. So start off with, can you give me a little backstory on your work history? And what led you to creating some of the solutions you have for the GI programs?
Sure, Robo. Well, I did graduate from Texas A&M University from the vet school there, as well as Dr. Latson, and actually our friendship started in undergraduate school, and we were roommates through vet school. And after I finished in College Station, I moved to Southern California, practiced there for an internship, and then went to the University of Florida for 3 years to do that specialty training that you were talking about, the residency training. So that was 4 years after veterinary school that I spent honing my skills in a very specialty oriented discipline, internal medicine, which deals with infectious disease, heart problems, any of the gastrointestinal problems that horses have, neurologic problems, any of a host of complicated things that don't require surgery and that don't involve reproduction. We are the last stop for people to seek answers and treatment with their horses. So after we finished that, we moved down to Australia and practiced in a referral setting, and I ran an intensive care unit and was medical director at Goulburn Valley Equine Hospital for a couple of years, and then we moved back to Florida, and I set up another intensive care unit at Equine Medical Center of Ocala. And so I was busy in the heart of the thoroughbred country in Ocala, and also worked with a lot of English sport horses and Pasafinos. After 3 years in Ocala, we moved home to Texas, and we're in Weatherford, where I set up the third intensive care unit that I've set up in my career, and that was at Weatherford Equine Medical Center. Again, in a slightly different discipline, being the hub of the cutting horse industry, but had a wonderful experience working with the veterinarians there. We were there for 5 years, and subsequently I have started my own consulting business. So it's been a good run, and throughout that process, I've really changed a lot of my own paradigm of managing disease and managing horses. I think as veterinarians, we're first taught about disease and about how disease happens, and then how we can mitigate the effects of disease, largely by using medicine and surgery to do that. I think that one thing that I've found to be very important is actually nutrition, both personally and also professionally, and in the way that I care for my patients. I realize that if we're not very conscientious about what these animals are actually putting into their system and making sure that it's optimized and that their systems are optimized, that the medicine and the surgery that we provide is really a Band-Aid, and sometimes can can create problems if you don't balance that nutritional plan with the medicine. So nutrition is a big part of recovery and optimizing health in all animals. Horses are no different, and certainly our elite athletes are very, very sensitive to nutritional and gastrointestinal disturbances. I think that when Dr. Latson and I first got together about coming up with some nutritional supplementations, we were dealing with elite athletes, and we were putting these athletes through some surgical procedures to remove chips and to fix fractures in the athletes. And when we did that, we were having to give them antibiotics just as a matter of course. We give them short duration antibiotics to try to prevent any infection from the surgery. And with the combination of the antibiotics and also the anesthesia, where you basically got a 1,200-pound horse laying on their back for 30 minutes and then recovering for another 30 minutes. Whenever you immobilize a horse, you actually also immobilize their gut. And so their gut normally blends and churns and has a normal propulsive activity that assists in the fermentation. And whenever you put them under anesthesia, you stop all that. And so that fermentation, if you think about anytime you fermented anything, and I don't know, Robo, if you're still a home brewer or home winemaker, but chances are we've all been privy to the fermentation process, but it requires a constant stirring, right? And so if you let that just sit, then that fermentation process gets thrown off. So my point being is that these horses were getting fed lots of good food, so their systems were being strained to operate at the maximum level. Then they were getting antibiotics, which we know kills off not just the bad, but also the good. And then we were putting them under anesthesia. And we occasionally see some diarrhea. And sometimes that diarrhea can become life-threatening in relation to all three of those factors. And so, that's the last thing that any of us want to happen when we have a horse that needs a chip taken out of its knee. We want to go in there, take the chip out, put the horse in a recovery plan, and get the horse back into work as soon as possible with as little pain and as quick a recovery. Whenever you get the horse in with that sort of plan in mind, and then all of a sudden 3 days later you find the horse fighting for its life because it's developed diarrhea, that's bad. It's bad for the horse. It's bad for the owner. It's bad for the trainer. It's bad for the veterinarian. So Dr. Latson and I began looking at strategies. What do they do in people to prevent this? Because this happens in people too. And that had pushed us into the probiotic arena, which we were both fairly familiar with and we're using to treat actual diarrhea, but not to go in there and try to stop it from happening, especially in these elective cases. And so we found a certain strain of probiotic that was had more science behind it than anything. A lot of nutritional supplements have very weak science, and certainly they don't go through the research trials that we really need as scientists to say that something works or doesn't work. But this one actually did, and it had all those criteria that made it something very, very useful. And so we started getting to human preparation, and we started opening up all these capsules, and it was pretty funny. My nurses absolutely despised me when I would write that on the patient's orders, and so we were opening up these little capsules and dumping it into a syringe, and then drenching the horses with it, and we found it to be extremely effective as far as minimizing the antibiotic-associated diarrhea and anesthesia-related diarrhea and the change of feed and all those sort of things that can create a GI disturbance. And, while we found that it worked, just like anytime we find something that works in veterinary medicine, we call our colleagues, we talk about things, we share at continuing education meetings, and so that's what we did. And we were telling people about this. I think as a profession in general, people were becoming more sensitive to the benefit of probiotics, but still trying to wade through where is the science, where is the body of knowledge in terms of what works, how much do you need to give, what are the indications, are there any complications? We're all wading through that, and Keith and I really got further down the line in that than many people, and so we were sharing, and then people wanted to know, how they could get it, and we were sharing the human preparation, and then what we found is the owner compliance was terrible with that. So meaning, if I sent someone home with a bunch of capsules and said open up 20 capsules a day and give it to your horse, then they'd laugh at me. They'd laugh at me, and most of the time the horse didn't.
I would do.
Yeah, exactly. So that pushed us into the arena of making it ourselves and going through the process of having the right formulation developed for the horse. And so we came up with that, and we started using that in our own practices, and then started sharing that with our friends. And before long, it had a grass fire effect and spread all over the country.
Okay, awesome. And so I'm gonna back up, kind of back to the beginning of where you were talking about the fermentation in the gut. Just for people, all horse owners who've been around horses for a while have heard the term hindgut. But could you kind of explain the differences in the actual physiology between a horse and, say, our gut or a cow's gut, and when you talk about fermentation, how that's related to the horses specifically?
Yeah, that's a good question. And as veterinarians, we spend years studying anatomy and physiology and the differences between the different animal species, and really it breaks down. There's three basic types of intestinal tracts, and there's variants in all of them, but the first would be the ruminant, and that would be the cud chewer, that would be the deer, the cattle, the animals that whenever they get the roughage, they put it into a very large compartment. There's actually 4 compartments in their stomach. A lot of people refer to them as having 4 stomachs, but actually what we refer to them as having 4, meaning FORE, is all their fermentation takes place in the front part of their digestive tract. So they take in the grass, it blends around in this big compartment called the rumen. They burp it up, they chew their cud, goes back in there. That chewing the cud is just a process to break down the grass and the hay and to get the fiber broken down into small pieces, so that microbes or little bacteria and fungi and protozoa can get into that and break it down, and they can get nutrients out of it. And so that process goes in, and it goes on downstream. Then they have some enzymatic process as well, where they have enzymes that the animal makes that break down the food more and more, and then they're able to absorb it, and then it passes on further down. Now, another type of fermentation is the hindgut fermenters, and this is mostly horses, and rabbits would be a hindgut fermenter. So the animals still rely on fermentation to digest their food, but they don't chew their cud, because all this happens way downstream, so at the very back part of the intestinal tract. So cattle are foregut fermentators, horses are hindgut fermentators. So that
explains quite a bit. That I've heard those terms a lot, but I think that's the first time that I've understood that part.
Right. And if you just look at them chewing their cud, you can tell what they're doing. But horses, so when their food first goes in, they actually go through that enzymatic process first to get them to digest a lot of their food through the enzymes. That happens in the stomach. That happens with the pancreas and the juices that come out of the liver, and then the small intestine, and then all the hay and everything that's not digested enzymatically. So this is going to be corn, oats, any of the grains that we put in there. Then those things actually get go through the fermentation process when they should have been broken down by the enzymes. And sometimes you don't want things back in the fermentation process because they ferment too rapidly. They ferment in a very negative way. The horse's intestine and their cecum, which is the same as our appendix, but it's about 3 or 4 gallons big, where our appendix is like that big. These things hold massive amounts of fluid, and the fermentation is it's a very delicate balance because they can't eructate or burp like a cattle, and they can't just add more saliva to it. It's basically a sealed part of their intestinal tract in the back, that the only way gas and stuff can get out is by them passing gas or having flatulence, which we all know when we've had horses gas colic often. That's because all that gas is being produced, which a cow normally just burps up very easily. Well, all that gas has to get out through the back end in a horse, and if there's any obstruction or problem with that gas getting out, then they very quickly bloat, and they can have severe abdominal pain or colic. Now, the third type of intestinal tract, now that we're all thoroughly confused, we got the fore and the hindgut, but is a monogastric tract, and that's going to be similar to what a dog has, or what a pig has, or what a human has, right? So those animals primarily work by enzymatic digestion in the stomach and the pancreas and the liver, and using the small intestine. And we have a little bit of capacity to ferment our food, but not a lot. Our colons, where fermentation takes place, are proportionally, a tenth or less of the size of a horse's. So, we have a hard time. If we're just going to go eat grass, we wouldn't get by very well. If you're just going to go have straight salad every day, you wouldn't get by very well. There is nutrition in that stuff, but really you have to be able to ferment a lot of it to be able to get the maximum nutrition out. We just don't have the capacity. We need to enzymatically digest a lot of our food. Now, that leads into a big problem whenever we're trying to get cattle or horses to produce more. So if you're in the cattle industry, you're either in the meat or the dairy industry, and you're trying to get as much milk or meat out of those animals as possible. And so you're putting food in there and trying to get that fermentation process to run as efficiently as possible, and also trying to utilize their enzymatic processes as efficiently as possible. Now let's talk about the horse. When we have an elite athlete that we're training and exercising every day, the horse is just at the top of his game. If you think, Robo, when you and I exercise, we have to really change our diet. We have to be able to provide those amino acids. We have to provide the energy substrates for us to perform. And we have to provide the vitamins for our body to utilize to recover as well. All that has to be optimized for you to get optimal results as an athlete. So the first thing that we typically look at is energy and making sure that animals get enough energy. A horse can only ferment so much food. You can't just give them more alfalfa hay, right? I mean, we know that's not going to work, that more grass.
Maximize that effort.
I'm sorry?
You can maximize the input effort.
You can reach a threshold that they can't do any more with the hay, or you'll have deleterious effects with the hay. So if you took like grass hay and you just said, I'm going to feed the horse as much grass hay as they can eat, they can't eat, and I'm going to put them in the race training, or I'm going to make him a competitive barrel athlete or an endurance horse. You can't get enough into the system to have the energy that the animal needs to operate. Okay. Let's take another substrate such as alfalfa. Well, if I just gave my horse free choice alfalfa, we all know that the alfalfa is too rich and they're going to colic. So if he just had 24 hours a day, the horse ate alfalfa, the horse is going to colic and probably get diarrhea. Same thing with grain. I need to go, so if I have an acceptable amount of hay, but I've reached the threshold on the hay because anymore they may colic, or there's not enough nutrients in the hay for them to get any more, then I've got to go with a grain. And the grain also has a threshold, because when you utilize the grain, you're maximizing the enzymatic part of the fermentation process. The enzymes have to go in there and break that grain down, and you have to break most of it down, because otherwise, if you get a lot of corn and stuff headed back to the fermentation vat, it will create chaos on the fermentation vat. You will get the pH of that, the acid level will go way up, and the pH will go way down, and you'll kill all the good microbes in the back part of the intestinal tract. That's why if horses break into the feed barn and they get into the deer corn, or they eat a whole bag of oats or something like that, that's why they get sick, is because all that grain cannot be enzymatically digested. It gets back there, gets fermented, and it creates total chaos. And horses founder, diarrhea, and they die from that whole process. Have you seen that before? Yeah. And it is frustrating. As a veterinarian, I hate that when people bring in that sick horse and it's all bloated, and they say, yeah, it got into the grain room, or got in the feed room and got into a bag of grain. But
so it sounds like just a side note. Sort of sounds a little bit like there needs to be a real balance in all of that.
You're exactly right. And that's the answer with these athletes, is finding that balance. And what we normally see is that producers or trainers take the animals and they put as much into them as they can until they get on that tipping point of they start to see problems with them, with diarrhea or with colic. And whenever they see too much of that, well, then they back off a little bit. That's one way to do it. That's not the optimal way to do it. But that's one way. Like anything, you try to hit it as hard as you can, and then you see a problem, then you back off a little bit. But we prefer to take a little more proactive approach, realize what the problems are, and try to mitigate those before they even have a chance of happening. So what you want to do is create that balance by feeding them the good roughage that they need. They need the fiber. That's where they're going to ferment. And then you want to give them the good grain part that has all the energy that makes up for the lack of energy in the fiber product, but let them digest that in the best way possible in the front part of their intestinal tract with the enzymes. And so you don't get a big load that goes of corn and grain that goes to the back part of the intestinal tract that creates, havoc on the fermentation process. So that's the general anatomy, physiology of the three types of digestive tracts, and then what the limitations are. Now, out in the wild, Robo, it's bison or cattle or horses, they're going to do fine on just eating grass, and really their tracts are set up for that because their demands aren't high. They're not trying to make ribeyes and gallons of milk. They're trying to just sustain themselves, and horses aren't running a mile and a half like American Pharaoh. They're just need to outrun the slowest one in the herd, and to keep the wolves off their heels. That's about all they need to do. So it's only through us needing to optimize these horses to be the top athletes that we need to even consider feeding them any of the grain substances or other energy substances, the fats and oils that provide them with the necessary nutrition to perform at the levels that we're asking them to do, which is great. Their performance, let's face it, it is at an emotional level. Their performance is so cool, the way that people have interacted with horses. So whether or not that was years ago working with the horses or now competing with them in pleasure, we have had to feed our horses extra ever since we domesticated them because they're not wild. So it's not unnatural in the history of mankind to have to supplement the horses. It's just unnatural from the way the horse was initially designed whenever man wasn't involved.
So let me ask. So let's say I have some performance horses and I've got them in various stages of training and under different stresses. What are some common, if I'm trying to dial it in and figure out what I'm looking for, as far as like signs that I may be feeding too much, of one thing or another, or maybe not enough, what are some common signs I'd be looking for to help dial that in for me quicker?
Yeah, and some of them are very, very subtle, and some of them are very, very obvious. I mean, the most obvious one is going to be a horse that has so much fecal water that it develops pipe stream diarrhea, or it's painting the walls with diarrhea, or it's on its back colicking. And those are the most obvious signs. Now, probably if you look in in athletic barns, probably one of the more common signs you would see would be that they're, instead of having nice green road apples, that their manure is soft and maybe looks like that of a cow. That to me, as a veterinarian, is is a red flag that that horse's GI tract is not working optimally, and we're going to be seeing some more severe problems. We may be seeing a lack of performance that we can't put our finger on. But whenever I see that horse has that cow flop type of manure, I know that there is an issue with that cow, or with that cow flop manure that tells me that the GI tract's not working. So what other subtle things that horsemen come up with are a bad hair coat. They come up with the horse begins to go punky whenever they put the grain in. It only finishes half the grain meal, has a few bites, walks away, or just it begins to get a little sour during training. Normally those signs are that we've got a fermentation problem with the hindgut, and that the horse is getting too much acid built up in there. That may create some inflammation in there. It may even create some ulcers in the back part of the intestinal tract. Or they could be having ulcers develop in the front part of their intestinal tract in their stomach as well. And so those are very common symptoms of a GI disturbance, but they can be subtle. They can be subtle. I just spoke with a really good horseman yesterday, and who was describing some of those things. He's got some cutting horses that have It's summertime here in Texas. We're June. We've had mammoth rains over the past 6 weeks. There's grass everywhere. I mean, every horse should be dappled up and just looking peak, right? And when you've got healthy animals that are being fed the best feed in the world, and they're not dappled up, and their hair coats look rough, and they're on good worming programs and everything, it's a very clear sign to me that we've got a GI disturbance that is that's causing that. And that particular horse I'm talking about has already been scoped for ulcers. It doesn't have ulcers. It doesn't have sand. It doesn't have some of the other medical problems. It simply has an unoptimized GI tract.
Now, you mentioned ulcers. Is these effects that are this balance that we're talking about? Is that a big cause for ulcers as well?
Ulcers can, whether you're a person or you're a horse, ulcers can develop for a number of reasons. And one of the big things is a balance in nutrition, or a balance in, for you and I, it may be life balance, but in horses, it's a balance in stress and well-being as well. So you and I think about stress with work and with getting to family events and making sure that we're present with our children and stuff. But horses are herd animals, and the way that we manage them is not natural at all. So whenever you've got an athlete that's spending time in a barn, in a stall, away from others, not able to kick his heels up and run around in a pasture, that creates physiologic stress. And stress is not just a mental problem. It actually creates a cascade of hormone releases that actually have a physiologic effect that is supposed to be in short doses, supposed to be enough for us to grit our teeth and to get through something that's difficult. But in chronic doses, that those hormones are actually detrimental, right? They're detrimental to all parts of our bodies, whether that's your joints or your stomach. Stress is hard on us. It's hard on horses too. And one of the places that they do show that is in their stomach and their and even their their hindgut, they can show intestinal stress. So that's part of it is balance. The other part is the balance with the nutrition and us trying to put too much rocket fuel into the horses, and their systems aren't optimized to be able to cope with that. And so we can do some things to try to get their systems to be able to cope with that, because they do. I mean, at the end of the day, they need that energy. They need those vitamins. They need those minerals. They need that fiber. They need all that stuff that we're trying to put in front of them. They can't get it out. I mean, it's, a rocket needs rocket fuel. But if you've got a problem with the system where you can't get all that, you're running the system too rich, then you're going to have a lot of unburnt rocket fuel come out the back end. And when you get a lot of unburnt rocket fuel or grain and energy in a horse, it goes into the back part of that intestinal tract, and that's again where they get that disturbance with the whole fermentation process, and they get diarrhea, they get a sour gut, they get hindgut ulcers, and you get poor performance. You get a horse that just doesn't feel good.
So to clarify, what you're really saying is that if I have these horses under extreme, training programs, or maybe even not that extreme, and I'm trying to keep weight on them and give them energy, I can be pouring really good food in the front end, and if the system's not set up correctly, I'm basically just making the problem worse.
You're number one, you're wasting a lot of money, and number two, you're adding. It's not. They've already have enough. They're just not able to get it out. They're not able to get that nutrition out. I always laugh because I never really understood Einstein's E equals MC squared. I think you and I talked about this one time, but the thing is that the energy that is in any given mass of food is so dense. There's so much energy in there. And Einstein's theory was that it's MC squared. C is the speed of light, and then you square that. That's a big number getting squared, right? And M is mass, or the amount of substance. Well, if you think about energy, E equals the mass times the speed of light squared, that's huge. Well, we're talking about, say, grain. Well, there is so much energy in grain that the body has to try to get that energy out. Well, a lot of that doesn't come out. Most of it, 99.99%, doesn't come out. According to Einstein's theory, I mean, there's a lot in there. We could all sustain ourselves for a long time on one corn kernel if we were able to optimally get all the energy out. We see a lot of stuff go into the stall floor, right? Undigested food, especially in these athletes where they're being pushed so hard. So what I'm saying is that as a trainer, or you like to team rope, in your rope horses, if you're taking that horse and it's not gaining weight, you just try to put more food in there, assuming that you're providing a basic diet of good nutrition to begin with, that's not the answer. The answer is to try to get what you're putting in that horse twice a day already, and the grass and the hay that's eating throughout the day is getting all the energy out of that you can. And so don't go buy more feed, and don't go try to give them an extra scoop of grain. Try to get all the energy out from the stuff you're already giving them to begin with.
That's a really interesting perspective, and one I think that a lot of people aren't really getting at all.
Yeah.
So I know that you are not a fan. We're talking about nutritional supplementation. I know that you are not a fan of just supplementing for supplement's sake, and I also know that you're not a fan of putting minute amounts of everything in to supplement. So can you kind of summarize what a good philosophy is for supplementation as far as concentrations and ingredients?
Yeah, and that's I think as veterinarians we're a little bit sensitive to that, because quite honestly, people get marketed to in a way that makes them feel compelled to get some of everything into their horse.
I think that, as a side deal, I've been guilty myself just with my own personal supplementation. prior to our discussions over the past few years, I would go pick up a can of some sort of supplement for my workouts, and I'd try to get the one with the most ingredients on it.
Right.
I just want it loaded up.
Right.
I got everything. It must be good if there's 1,000 things in it.
Right. Exactly. And that's and that's tough because we're marketed that way for our horses and for ourselves. And it's like, where's the truth? And even when you look at something like probiotics, where's the truth with probiotics? And let's face it, we don't know everything about anything. But what we do know is that there are, if you just put a little bit of everything into your system, you're not going to have any effect. It's like trying to go to work and work 1,000 different jobs and expect to get a paycheck. You're not going to get a paycheck. Your body's not going to get a paycheck from the nutrition if you just did a little bit of everything. But we do know that there are some core things that you can put into the system. We'll call it a system because the digestive tract is a very complex system. We know that we can optimize that by putting some select things in there. But just like if you were going to work and you wanted to focus on getting a result, you would make sure that you put enough effort into that system to get a measurable result. That is where I think that quantity and quality begin to be big players in these supplements. It's not just the diversity of the amount of ingredients that are in there. You can have 75 ingredients in there and not have a measurable amount of any of them. And so, you're essentially wasting your money. And a lot of our multivitamins are that way for ourselves as well. And there's a lot that go into horses that are designed exactly. In the industry, we call that label dressing. It's there on the label. People don't know if their horse needs 1 milligram or 1,000 milligrams or 1,000 grams of a specific item, right? They see the item, it must be good. There's 75 other items in there. It's got to be good, and it's hard to know enough about all that stuff to make an informed decision. Then we start talking about quality. A lot of these nutritional ingredients don't even get absorbed. The way they're combined with other ingredients, they don't get absorbed. The way that they're formulated, there are certain vitamin E's that are formulated to be preservatives. They're to make sure that the product doesn't get rancid while it's sitting on the shelf. It has absolutely zero nutritional benefit. Your body can't absorb it, yet it's listed as a source of vitamin E. And so if someone goes in looking for vitamin E, then they pick that up. That horse is going to absorb zero of that particular type of vitamin E. So all those ingredients have quality disclaimers and they have quantity disclaimers. And it's hard for us to be able to say, on every level what the animal needs. But in some cases, we do know through National Research Council on how much animals need. We know how much athletes need. We know that some things need over-supplementation. Certain B vitamins need over-supplementation in athletes. We also know that whenever it comes time to talk about something like probiotics, that they really it's a numbers game. You're playing in a body system that is operating on the order of trillions of microbes, right? So that's, 1,000 billions is a trillion, and we're talking about hundreds of trillions of microbes. That's a big number. So if we're going to have any sort of impact in there, you've got to actually put effective numbers in there. They've got to also survive the being in the bottle or in the tub. They got to survive the heat and the moisture in the environment. They got to survive the digestive tract, the enzymes that are in the front part of the intestinal tract, in the stomach, in the small intestine, and they've got to make it all the way back to the back into the hindgut where all that fermentation takes place. So that's probiotics. I mean, that in itself is hard for consumers to know because they see it's a probiotic and then they see this one's got 5 strains, this one's got 50 strains, this one's got 1 strain. They don't know the right strain, and then some of the strains, the genus is the same, so the first part of the name would be the same, and the second part of the name, what we call the species name, those are different. Well, those can be as different as if you're a horseman, you know about strangles. Well, strangles is caused by a bacteria called Streptococcus equi, subspecies equi. That is a very contagious, virulent disease. It has a cousin named Streptococcus equi, subspecies zooepidemicus, that I can paint all over your horse's nose, and it wouldn't get sick for a minute. And so it's so confusing to the horse owner to know what to go look for. It's even confusing for the veterinarian. I mean, we study a lot of microbiology to be able to understand diseases and virus and bacteria, and to be able to understand those nuances that I just explained. Well, we also have to know the nuances of the good bacteria and the good fungi that are out there that can be able to help these animals, and that's why we go to continuing education. That's why we read journals and stay in research throughout our entire career so that we can understand that. And it's hard to expect a horse owner to understand that whenever we as professionals have to stay on top of our game just to be able to get our heads around that.
Yeah. So, and kind of as a follow-up to that, do you happen to know of, I think I know part of your answer, but do you happen to know of some areas where interested horse owners could maybe learn more, or where should they pay attention and get their education from?
Well, I'm always going to advocate for the veterinarian being the number one source of nutritional information.
I nailed that one.
Yeah, kind of like asking a dentist where to get information on a toothbrush or toothpaste, right? We feel like out of everyone, we're going to have more working knowledge in those areas than any other source. Honestly, the farrier's probably doesn't have any nutritional background. There are ag extension, people especially in Texas, in the Midwest, there are people that are there to provide nutritional guidance as far as pastoral management and things like that. So I think that they're another trusted resource, as are the agricultural universities. But in terms of having direct access and things that you could, people you can interact with on a daily basis, really, who else is there other than the veterinarian that has any training on these things? I will admit, and I think people are very quick to criticize and say, physicians and veterinarians, they only get so many classes of nutrition, and that's that is true. That we get. We've already talked about the number of different species that we study as veterinarians, and to understand those different digestive tracts and how the nutrition interacts with those different digestive tracts. But we still, our working knowledge is there. Whether or not we have a particular interest and we dive more into that, and we go to that with a detailed interest in reading journals and going to continuing education. Some people do, some people don't. It's like asking your orthopedic surgeon to know all about what supplement should my grandfather who's got Alzheimer's take. That's beyond the scope. He can tell you exactly everything there is to know about a joint and probably what effects nutrition has on the joint, but we can't know everything about everything. And so I would just put that as a disclaimer, but I think as far as a general trusted source, there's no one better.
Okay. Awesome. So I know that, your involvement with FullBucket and your and Keith's reason for getting it going is a really great story, and it goes beyond just you guys putting product into a tube so that your colleagues could have access to it. Why don't you kind of give us a little bit of information about your philanthropy and sort of the fuel that drives your bus?
Well, that is a fun part to talk about for sure. Keith and I are obviously very passionate about our profession as veterinarians. We feel like we really had, a great opportunity to be veterinarians. A lot of people have a lot of respect for the industry. It's very charitable in itself, and it's very rewarding just to be able to help people with their animals and to see the enjoyment that people get with their animals. I think that as we got into FullBucket and as we started to become entrepreneurs, I think that was the time that we started to try to rationalize that. We didn't have to rationalize our veterinary practice very much. You bring me your horse and I make it better, and that there's a lot of value that's instilled in just that process. I think that we feel somewhat the same if you buy one of our products, if we feel like we've got good value and hopefully your horse is going to feel better after being on our product. But we also felt like we've got a business and we need to be good stewards of that business and the resources and the money that business brings in. And so we started looking for ways to use the business as a platform to help other people and to also help fellow veterinarians help other people. And that's where we started looking into volunteer work as veterinarians, and we started going internationally into third world countries and working on working animals. There's over 100 million working animals in the world that provide transportation and also cargo. They're cargo animals in lots of parts where people don't have access to a pickup truck. They're working in mountainous regions that, hauling coffee and firewood out of these places that those loads would be on a backpack, a very crude backpack, or be on their head and be on their kids' heads, and their kids wouldn't be in school. And so these donkeys and horses that operate as working animals, they are the lifeblood to these families, and they're very valuable. They're very expensive for families that make on average $1 to $2 a day. These animals can cost $300 to $1,000. That's dang near half a year's work to get one of these animals. They have no idea how to take care of them. They don't know how to prolong them. It'd be like giving them a tractor and not showing them how to change the oil or how to lubricate the fittings and the bearings. What's going to happen? That exactly what happens when people donate tractors in those areas. You and I have been down there. We've seen those tractors on the side of the road. There's no education, right? They get a tractor and they use it until it breaks, and then it's broken, and then they either wait for a new one or go back to doing things without a tractor. And so Keith and I found that there is a need for service. So going down and taking care of these animals, they're heavily parasitized, Robo. They need dental care. They need wound care. Their saddle sores just, make you just pass out, with some of the saddle sores that you see. Their orthopedic disease, broken down legs and tendons and ligaments and things are just terrible. But so there's an immediate care that we provide by doing these volunteer trips. There's also a longer-term care, and that is where we work with the owners and probably even more importantly with the local veterinarians to provide continuing education on how they can care for these animals and also instruct their own countrymen on how to keep these animals going for longer periods of time. And from a welfare aspect, we're hoping that these animals can work, but they can work pain-free, for years to come. It's not a short cycle that they don't have to unnecessarily get orthopedic disease or saddle sores or eye trauma because the people are not educated on how to care for them. We also found that the nutrition there is, again, we're talking about working animals. So we've already discussed that they need more than just forage to get by, right? You can't get enough energy if I were to put you and work in the hills of Guatemala and said carry down coffee beans, and I was just going to feed you a piece of bread and some water. You're going to quickly get down to a very low body condition, and you're not going to have any of the micronutrients, the minerals and vitamins, amino acids that your body needs to recover from a hard day's work, and also to grow, because these animals get worked very young, right? And they're still growing, and with bad nutrition, they get terrible orthopedic disease. So we began to look and say, okay, well, we can help these people as veterinarians. We can also help them because we're a nutritional company. And so that was sort of, we used FullBucket as a platform to to go down and operate on a volunteer basis as veterinarians. We also use it as a way to get better nutrition. So we do for every serving FullBucket that we provide in the U.S., we provide a serving of a specially manufactured FullBucket. It's made internationally in the country of origin. That's developed for those working animals specifically to address some of their shortcomings in their nutrition. So we provide those to those working animals on a one-for-one basis. It's great. You can quickly see the benefits of the animals in terms of some of the more basic things like hoof growth and hair coat. But you can also see their body condition scores begin to improve over time as well. I think that there's also something that goes along with whenever you provide an owner with something that is going to enhance the well-being of their animal. They all of a sudden begin to take pride in their animal a little bit more. Maybe things don't look quite as hopeless as they looked before. We try to provide them a little education. We deworm them. We get them some better nutrition. And then all of a sudden, people, it's kind of like if you had a junk car and I took your junk car and I put it in the car wash, I gave it an oil change, and I gave you some special fuel additive. You're kind of going to bow up a little bit and take a little pride in your junk car, and you're going to maybe repair the tires and keep things lubricated and do some stuff where you care a little bit more about it. And I think sometimes they just feel so hopeless. But the last thing I would say is that, and some of the coolest part of it is being able to interact with the local veterinarians. Robo, they go to school and they're so passionate about animals in these countries, but their opportunity to be educated at the level that we are is certainly not there. Their experience is not there. The work for them whenever they get done, there's just, there's only so many people that have. There's a lot of have-nots. So to be able to get paid and do horse work, it's pretty hard. And then there's no provision for continuing education. As a veterinarian in Texas, we're required to get 17 hours of continuing education every year. That means we go to meetings to learn what's new, review research and talk with colleagues. And over, I've been in practice for 16 years. That's 250 hours of continuing education at minimum, and I typically attend several conferences a year, to stay up. They get none. There's none required, and there's none provided. And so, I think with our volunteer group, we go down and we spend one day providing continuing education to these veterinarians and veterinary students, and where we can just talk with them as a group and one-on-one. Lay our hands on horses together, share some of the stuff we know. And I think that can be awesome. That's kind of going back to teaching people to fish. And we're all about that. We've met some great friends. We've had people that have been provided opportunities to come to Texas and come work and to come learn, more in depth through externships and internships. And those people have never had that opportunity, and I would have never had that opportunity to share that with them if it weren't for FullBucket. I think so. FullBucket it provides such a conduit for us to reach people. And I thought I was done, but I'll say one more thing.
No, keep going. This is good.
Well, I think, and because you've been there, and you and I share a lot of the same friends, but I think FullBucket also provides something for our veterinarians in the U.S. as well. I think that innately all of us have the desire to give back, right? And just in our lives, we're constantly looking for where are those opportunities? Are they with our community? Are they with our church? Are they at a local soup kitchen? Are they through the Rotary? Are they, where are they? But we're always looking. And we want that satisfaction that what we're doing is meaningful, and that what we do, maybe we're using unique skills of our own that no one else has, and we're using those skills that we bust our tails for lots of years to develop ourselves as veterinarians, and we're using those on people in a way that you as a non-veterinarian wouldn't be able to do. And that's where I think that FullBucket and getting behind this type of work you've seen the number of veterinarians that have all of a sudden there's been a door open for them to go and plug in, and I think that's massive. To me, I take a lot of pride in that. I love to see people find their wings and they go down. And I've had veterinarians who are ultra successful, top of their game, and also some very well traveled veterinarians, some veterinarians that take extravagant vacations. And I've had them tell me that there's nothing better. They have not spent a better week in their life. And these are people that go to Hawaii all the time, that go and work on the best horses in the world, and they go and they sweat in the hills of Guatemala, and they eat dodgy street food and sleep on uncomfortable beds, and they say that that's the best week of their year, and they go back year after year because it feels so good to give back. And I think as a company, for FullBucket, it feels good to give back.
I hear that from the horse owners as well, that their participation with FullBucket, just through the support of the products and things like that is another tie back to, at least giving back in some manner.
Right.
To get.
You're exactly right. And I think that, people have a choice these days, that businesses like ours are showing up every day in all parts of the marketplace. And, I think people have a choice. They can choose to support companies that have benevolence. In ours is, we advertise a 1-for-1, but, there's really so many facets of what we do. I think the cool stuff we're going to do with AAP this winter, and with the Santa jackets, and it's just it goes beyond just the 1-for-1. I think that is certainly our battle cry, but I think we can't help ourselves but try to find new ways to give, and I think that consumers have that opportunity. They can choose to do business with people that share that spirit, or they can choose to do business with people that don't. And I wouldn't shame anyone for not. But I just think that it's certainly good to be that alternative in the marketplace that gives those people a chance. Because even as a consumer, you want your money to go good. Who doesn't round up for a good cause? On Amazon or something like that. It's the right thing to do, and I think we're all kind of feel better in our Western shopping experience when we do something like that, because we all have a lot to give.
Yeah, I agree, and Rob, I think we're going to wrap it up, but I want to thank you so much for taking time out of your busy schedule and visiting today, and and if anyone wants to learn more, they can go to FullBucket.org. That's FullBucket.org. To learn more about the products themselves and the philanthropy. There's some really cool videos and information on there, and there's a lot of documentation and white papers that if you want to drive deeper into knowing more about probiotics or supplements, you can learn there. And thanks again, Rob, and we'll see you soon.
My pleasure. Talk to you later.
Take care.